That was my computer saying it's 4 o'clock, but I'm going to give another minute or two. And then we'll get into the fun of Medicare.
Woohoo.
For another 30 seconds, we'll let people get situated and we'll get started. Okay, everyone. I wanted to welcome everyone to our webinar on Medicare, a cornerstone of the US healthcare system. Established in 1965, Medicare ensures healthcare access for millions, covering individuals aged 65 and older and those with certain disabilities. Today, we will unravel the complexities of its various parts, eligibility criteria, and benefits. Our expert panelist, Pamela Ponce Johnson, is an independent life and health insurance broker from Franklin Park, New Jersey, who has been working with Medicare clients for 10 years. Pamela is licensed in 15 states and has Medicare contracts with private Medicare insurance companies such as Aetna, AARP United Healthcare, Cigna, Clover, Horizon Blue Cross Blue Shield, Humana, WellCare, among others. In addition to Medicare insurance, she also offers long-term care insurance, final expense insurance, dental and vision plans, as well as indemnity plans for critical illness and hospital stays. Pamela assists her clients through the process of understanding their choices with respect to Medicare planning in order to make an informed decision. During the pandemic, her largely face-to-face business transformed to a mainly virtual business as people became more comfortable with Zoom meetings. Pamela attributes her success to her independence and her ability to listen and understand her clients' needs and recommend solutions to fit those needs. Presently, she works with people who are turning 65 and new to Medicare, as well as people who are retiring to help them fully understand their Medicare choice for comprehensive healthcare coverage. Pamela enjoys serving the community through her church's outreach committee, and in her spare time enjoys traveling with her husband Curtis and 3 adult children ages 18, 22, and 24. Some housekeeping. We will have polls throughout the presentation and we'll break for questions and answers, so please participate. Also, feel free to ask questions in the chat or in the Q&A section. Pamela, the screen is yours.
Oh, thank you. Well, good afternoon, everyone. And thank you, Jill and the Forefront Wealth Management team for inviting me today to join you and your clients for this very important conversation about Medicare. And as Jill mentioned, I've been helping Medicare clients for 10 years now, and I take great pride in helping to make a complicated process a little bit less stressful for my clients. So there's so much noise and misinformation when it comes to Medicare, and I hope to clarify some of the common misconceptions and answer any questions you may have. So to begin, it will be very helpful to know a little bit about who's here today concerning Medicare, and we have a few poll questions for you. So the first one, Jill, if you could put up, it reads, are you Medicare eligible? And specify what you're enrolled in. Medicare Part A, Medicare Part B, both A and B, neither, I'm not yet eligible, or I'm not sure. So give it a second for you to respond, and that will help us know how to steer our comments today. Okay, so looks like most people already have both Medicare Part A and B. Okay. All right. So that will then bring us to our poll number, question number 2. This is a follow-up question. How do you get your healthcare coverage? A, I'm Medicare eligible and have Medicare health insurance plan. I'm covered through my employer. The third, I'm covered under my spouse's employer. I have individual health insurance, or I do not have health insurance. Okay. Okay, so a number of you already have a Medicare plan and some spousal coverage. Okay, great. Just one more. Let's see. So for those of you who do have a Medicare health insurance plan, we're going to put up a third poll question. How do you get that additional Medicare coverage? Do you have original Medicare, Part A and B, and no other Medicare plan? You have original Medicare and a Medicare supplement, also known as Medigap plan. See, the third one, I have a Medicare Advantage plan, or I have something, but I'm not sure what kind of plan it is. Okay, so, okay. All right, so we have a good mix here. Thank you very much, Jill. That's very helpful. And I love the participation part of something like this, since we can't see one another, but we know you're there. So many of you already have Medicare and maybe a little bit more advanced than others. However, I have found that many people who have Medicare don't completely understand how it works. And if it's okay with all of you, I'd like to review the basics and then dive into some details. Additionally, I'll discuss a few things that are new in 2024. And I want to just reemphasize that to feel free to use that Q&A box to type your questions as we go. And Jill, please feel free to interrupt me and let me know if a question has popped up, because I'd like this to be as interactive as possible and get those questions answered as they come up. So I'm going to start to share the presentation, which is Medicare 101. So Jill mentioned a little bit about what Medicare is in her introduction. It is a federal system of health insurance for people age 65 or older, and for certain people who have disabilities and qualify for pension through Social Security for disabled people. It pays for part of individuals' healthcare expenses, and it's paid for by all of those years that you paid payroll taxes while you were working and paid into both Social Security and Medicare. So one of the myths, and I'll just hit it right up front. One of the things that when people hear about Medicare, we hear about Medicare for all, and it sounds like it's free, and it's not. So as we go through, we'll kind of explain what are the hidden pitfalls of, say, original Medicare, and why it's necessary to consider additional coverage. So when are people eligible? People are first eligible when they age in at age 65, and they've paid taxes into the program for 40 calendar quarters, or about 10 years. It doesn't have to be consecutive years. So people who took off time, perhaps to take care of kids and re-enter the workforce, often do qualify. Also, I mentioned people with certain disabilities and people with end-stage renal disease have a special enrollment for Medicare. And when we first turn 65, you may enroll 3 months before your birthday month, and 3 months after. That's the eligible time frame, which is a 7-month window. So what does Medicare cover? So there's a lot of letters. It's a alphabet intensive program, but Part A and Part B cover the basics of Medicare. So Part A is your hospital insurance, and Part B is your medical insurance, and we'll get to what's entailed. So Part A is pretty much everything that happens to you while you have a hospital stay, while you're admitted, not just in emergency room or in for observation. So if you have a hospital admission, everything that happens there, or an inpatient mental health care stay, anything that happens in the skilled nursing facility, some home health care, and hospice care would be under Part A, as well as some blood transfusions during an inpatient stay. Part B would be pretty much everything else: doctor's office visits, outpatient hospital services and outpatient surgeries, lab work, blood work, x-rays, home health care when it's a qualified reason, physical therapy, occupational therapy, durable medical equipment such as the wheelchairs and oxygen, and the ambulance, and any outpatient mental health services. So when we are eligible and we do get both parts of Medicare, A and B, we enroll in a Medicare, and we get a Medicare card. It's a red, white, and blue card. As brokers, we're not allowed to use the image of a Medicare card, but this represents on the far left original Medicare, what you're entitled to. And we'll get into the details of what Medicare covers and doesn't cover. But I want to just highlight that when you do become eligible, you have two options when you're first eligible for that additional health insurance coverage. Option one is to keep your original Medicare and add a Medicare supplement plan, or also known as Medigap insurance, to cover some of or all of the costs that are not covered by Parts A and B. They're offered by private insurance companies, and it's very standardized. So if you buy a Medigap plan from one company, it's going to offer the same benefits as a Medigap plan from another company. What would be different might be the premium and some other perks and benefits that they may add with the plan. But when you go that route and you stick with original Medicare, you also need prescription drug coverage, which is the Part D. That's also offered by private companies, and it's not offered through the government. So to have complete coverage of your hospital, doctors, and prescription drug plan, even if you go with original Medicare, you're going to need a prescription drug plan. If you don't get it when you're first eligible, you will have penalties down the road when you do need a prescription drug plan. So option 2 for that additional coverage is a Medicare Advantage plan, or Part C. I see a number of you have that currently. The Medicare Advantage plan combines the A and the B, and in many cases adds the D, the Part D prescription drug plan, for a comprehensive all-in-one plan. So back to the issue of what does Medicare cost. So Part A is there's typically no monthly premium for Medicare Part A if an individual qualifies and has paid into the system through their payroll taxes while they're working. As far as Part B, when you go off of perhaps an employer plan, or when you're first eligible, you will pay a monthly premium for Part B, which is based on household income, and that premium is paid no matter what type of plan you have, whether you're on original Medicare or Medicare plus another coverage, you still pay your Part B premium. So these are the costs for in 2023 for the Part B premium. As you can see, the higher the income, the more that your premium payment will be. The baseline premium for people earning individuals earning $97,000 or less, or a couple earning $194,000 or less, is $164.90 in 2023, and that's going up to $174.70 in 2024. So that's a change. Additionally, Social Security benefits are going to be increasing by a little over 3%. So you get a little bit more, but then they're going to take out a little bit more. Usually it's a wash. So this continues to look. Now we're going to look at what the costs are for you as a Medicare beneficiary recipient in a hospital stay. For example, the initial 60 days are covered, all but $1,600. That $1,600 is considered a deductible, and once you pay that $1,600, all of the rest of the expenses under original Medicare are covered for the first 60 days. Days 61 through 90, you're going to have a cost share of $400 a day up to day 90, and day 91 through 150, your responsibility would be $800 a day. As you can see, that would be quite an outlay if you did not have any kind of private Medicare insurance. And beyond 150 days, there's a lifetime reserve of 150 days. You would be responsible for all of the costs for any future hospital stays. In skilled nursing, many people are familiar with the 20 days. So after a hospital stay, the first 20 days of skilled nursing is 100% paid by Medicare. And that would be the case whether you have a Medicare supplement or an Advantage plan. Days 21 through 100, the cost share would be $200 a day. And that would be an original Medicare as well as with the Advantage plans. There's a cost share for day 21 through 100. After day 100 days in a skilled nursing facility, that's really considered long-term care and not covered by Medicare at all. A lot of people think that Medicare, Medicaid pays for nursing homes. It doesn't. That would be considered long-term care. And the type of planning that you should be considering as part of your future retirement planning. So under Medicare, in terms of the Part B costs, that again, that's the medical, the doctors, blood work, x-rays, exams, CT scans, all of that is covered under original Medicare at 80%. And 20% is what the individual's responsibility is after a deductible of $226. That's going up. Not exactly sure. I think it's a little over 230 in 2024. So again, 20% of, various medical procedures within a year. In a good year, maybe you don't have too many doctor's visits, but if you do have a condition or things that are ongoing, that could be a lot of exposure without a Medicare plan. So now we get at this point, I would actually see, were there any questions, Jill, or does anybody?
No, actually, everyone's been very quiet. So, or I'm not doing this correctly. It's one of the two, but no, there's no questions that come up. But actually, where you're going to be stepping in is one of the questions that I spoke to someone earlier. What are the pros and cons, Medicare Advantage versus a supplement? So I know that there's at least one person on the call that's interested in learning a little bit more about that.
Okay. Well, that's good. Okay. Yeah. So Medicare supplement versus Medicare Advantage. That's the question of the hour. And a lot of people ask me, well, Pam, which one is better? I want the best. I want the Cadillac. I want, and it depends. So there's really not a hard and fast answer to that. What I'd like to do with my clients is try to explain the differences and then kind of get an idea of what their personal preferences are. So Medicare supplement plans are available to those people who have both the Part A and the Part B. So that would be people who have retired, no longer getting any kind of other medical coverage through an employer, and now have their full Medicare benefit, A and B. They have to be a resident of the state in which they're getting that coverage. The Medicare supplement plans, as I mentioned, are standardized, but they are issued at the state level. And pricing is actually at the county level. So depending on if you live in a big state, you can't ask your friend that lives in another county what they're paying, because it might be different. It depends on in New Jersey, though, I think the rates are pretty standardized throughout the state, but in certain states, you could see different prices for different counties. So the Medicare supplement plans, if we didn't have enough talking about A, B, C, and D, the plan names for Medicare supplements are also alphabet letters, and they're basically A through N. They, again, are standardized, so they would be the same no matter what company you're with. The more comprehensive the coverage, the higher the monthly premium for the Medicare supplement plan. So when we look at these letter plans, you look at A through N, pretty much most people are considering, when they're first eligible, G and N. The G would be the one that's that top of the line that people say, I want everything. I want everything that I can possibly get, and they don't mind paying the premium for it. So you have plans G. The F plan was the previous top of the line, but is no longer, as of 2020, no longer available to people who are turning 65. If you were 65 before 2020, then you would be able to get an F plan. But we'll just go through the difference, highlight what it covers. So as I mentioned before, with original Medicare, you have deductibles both for the hospital and for doctors. So with the plan G and the N, the hospital deductible is covered, as well as all of those subsequent days in the hospital. And there's unlimited days. So whereas original Medicare capped it at 150 days, lifetime reserve, a Medicare supplement or Medigap plan would cover any hospitalization with no limit to the number of days in a lifetime. It does not cover the Part B deductible, which has to be met each calendar year. So, a lot of people, when they're new to Medicare, forget that they're not going to get any reimbursement for medical services until they've hit that deductible, which is this year $226. The other main thing would be that, and then if we look at G versus an N plan, that after that deductible is met, the 20% that's not covered by Medicare is paid for by the supplement plan. But in an N plan, you may pay a copay for doctor's visits of up to $20 per office visit. And that would be a main difference. So there is a copay. One thing to keep in mind for Medicare supplement plans is that there is no network. So that's one, thing that people find really attractive, that they can go to any doctor that accepts Medicare. They will accept the supplement plan as well. And it just fills in the gaps. The Medigap name is good because it just, you can think of it as filling in the gaps that Medicare doesn't pay. And then the only other difference between a G and an N is that doctors are permitted to bill for excess charges above Medicare approved reimbursement. So that's up to 15%. In a G plan, that would be completely covered, and that's not covered in an N plan. And the difference in the premium is significant. So for people who are looking to control costs, they might opt for that N plan and take their chances with the excess charges. My understanding is that you don't see it that often, but it is permitted. Some states don't permit it. New Jersey does permit excess charges. And then as far as foreign travel emergency services, original Medicare doesn't cover foreign travel, but the Medigap plans do. There is a limit of about $50,000, and then it covers at 80%. But I typically tell people that if you are going to travel internationally, I would highly recommend travel insurance to cover you for all kinds of things. I personally was in London in March of 2020. I'd gotten the travel insurance, which clearly said that it did not cover pandemic circumstances, but I just was worried about, getting stuck there, or what if I got sick, and I got it anyway. And I didn't get sick, but the border was closed while I was there, and I had to cancel my entire trip and come home. And I got all of it reimbursed through the travel insurance. So I highly recommend it. As far as enrollment eligibility, you do have an open enrollment within 6 months of getting your Part B coverage. So that's a guaranteed issue. There's no medical underwriting, and you have, well, during your initial open enrollment, you have 6 months to get it. If you're coming off of an employer plan, you have a guaranteed issue, and you have 60 days after the loss of the coverage to enroll in a Medicare supplement plan. There's no medical underwriting, but one thing to keep in mind is that if you don't get it through one of these open enrollment periods or guaranteed issue periods, and you say down the line want a Medicare supplement plan, you will have to go through medical underwriting to qualify for a Medicare supplement plan. So it's no longer, unlike a Medicare Advantage plan, they can't deny you for any reason. With the Medicare supplement, there's no medical exam, but you have to answer medical questions, and they will get information from your doctors and physicians. So at this point, does anybody have any questions about a Medicare supplement plan?
And those attending, feel free to raise your hand, unmute, type something if you're shy. We're here to answer questions. Okay, well, I'll keep going then. If something pops up, like I said, just interrupt me, Jill. So the Medicare Advantage plans are all-inclusive private insurance. It replaces the original Medicare, right? So you don't, with the supplement plan, when you go to the doctor, you'd have your original Medicare card, the red, white, and blue card. You'd have your Medicare supplement card, and those two documents would be presented to the billing of a doctor, a hospital, or a doctor's office. With the Medicare Advantage plan, you have one insurance card
for your hospital, doctors, and prescription drugs. Again, you have to continue to pay that Part B premium, and the benefits of an Advantage plan have to be equal to or better than original Medicare. Often they include dental, vision, fitness memberships, fitness equipment, over-the-counter benefits, 24-hour nurse hotline, and low, zero or very low monthly premiums. So in contrast to Medicare supplement plans, which are going to be over $100, say like $120 to $180 a month to start when you're 60, 65, and then go up as we age. The Medicare Advantage plans have low outlay, but keep in mind, you're paying that monthly Part B premium, so it's not free. People say, oh, this sounds too good to be true. It's free. It's not free. You're still paying your Part B premium. And then the government, for example, would pay Aetna or AARP to manage your care. And it's called managed care. Some people say, oh, I don't want an HMO. Well, they're different. There are a lot of different options within Medicare Advantage plans. Some of them require you to stick with a network. Some of them give you the opportunity to go in or out of network. So there are a lot of different options. And in New Jersey, now the Medicare Advantage plans are definitely different by county in New Jersey. So I don't know if most of you are in Monmouth County. Those would be different than the plans that we have here in Somerset County or even Mercer County. So these plans are at the county level. And the copays and deductibles would vary from plan to plan. So some questions we often get from people in terms of the Advantage plans, are my drugs covered? Can I see my own doctors? Do I have to get a referral from my doctor? Those things do vary from Advantage plan to Advantage plan. And when people say, what's the best Advantage plan? It's the plan that has your doctors in network and covers your medications. That would be my answer to anybody who's trying to decide between Advantage plans. This is the time of year when your mailboxes are flooded. You have commercials, you have people, telling you to call and, make sure you get all the benefits that you're entitled to. There's lots of advertising right now because it's the annual enrollment period, which started on October 15th and goes until December 7th. This is the time of year when you can, look at your plan and make a change for the new year for 2024. Lots of advertising. It's some people find it annoying. Some people feel that it makes them feel that they have to do something. And the only thing that I would say about that is if you're happy with your plan and it's working, you may want to just look and see if you have any changes in your medications, any new medications. You'll want to know that in 2024, those medications are covered, and you'll want to know, what your cost will be. That kind of brings us to the discussion about medications, because this is a pain point for many people. It's called Part D, and you can get it as a standalone plan, as I mentioned, with your Medigap and a Part D, or with original Medicare and a Part D, or you can get it as part of a Medicare Advantage plan. Either way, they really work the same way, whether it's standalone or part of a Medicare Advantage plan. The Part D part works the same. And frankly, this is the part that's most confusing to people. And if you're coming off of an employer plan or the ACA, Obamacare, it is different. And people have to it takes a little while to wrap your mind around all of the different tiers and all of the if-thens. Key things to note: when you have a Part D plan, you need to know what the preferred pharmacies are for that plan. Because if you love CVS is right down the block from you, and you love that CVS and you know all the people and you've known them for years, but you pick a Part D plan where Walgreens is the preferred provider, and either CVS is not covered or it's a standard, not preferred, you are going to pay more for your prescriptions. So that's just something little note for you to keep in mind. This, I'm not going to go into heavy detail other than to say that many Part D plans, whether it's an Advantage plan or whether it's standalone, have a deductible. The deductible is usually applies to your higher tier drugs. Most plans have either 5 or 6 tiers of drugs, and each tier drug has a different cost share. So after you meet the deductible, you're in that initial coverage stage, which is your step 2. That's when you have a set copay. Either it's a copay, your generics may be $0 or $5. Your higher tier drugs may be bigger cost shares, either a flat amount, such as a tier 3 drug might be $47 on one plan, and on another plan, it could be 25% of the retail cost. So that's why it's like, if you've been in a plan and you've had it for a long time, suddenly your costs are going up, you'll want to take a look at if you can save money by switching to a plan that would be better for the medications that you take. Once you get to a retail cost of drugs, all of your drugs reaches $4,660. That's for 2023. Then you move into what's called the coverage gap. It used to be the donut hole. A lot of people still think of it as the donut hole, but it's a coverage gap. During the coverage gap, no matter what drug you have, no matter what tier that drug is on, you're going to pay 25% of the retail cost of the drug. Now, a lot of times the drug plans negotiate pricing. So again, another reason to look at where you're filling your prescription. And so you could stay in the coverage gap. You could enter the coverage gap and stay in it for the remainder of the year. Or if you have very expensive drugs, you could get to the catastrophic level. The catastrophic phase is when you pay out of your pocket $7,400, that puts you into catastrophic coverage. In 2023, you still have to pay for drugs in the catastrophic coverage phase, but in new for 2024, they're eliminating that. So when you reach that, actually it's going up to 8,000. When you reach 8,000 true out-of-pocket cost, that's what the member pays. You're in the catastrophic phase and you won't pay another dime for any of your drugs. So that was something that was new to give relief. Another thing that's happened in the last few years is for people with diabetes, they've capped the monthly cost of insulin to $35. But again, you have to look at the formulary to figure out which insulins are covered for a specific drug plan. Just briefly, just like with the Part B premium, the Part D premium is based on your income. So that's just something, you want to think about.
I have a couple of questions, Pamela, if you want to take a break from that section.
Sure.
So one question came in that if you happen to own a second home, do you have the availability to choose the location of that home? Perhaps the pricing is better than maybe the original. Does it matter what home is primary versus vacation, or how does that work?
Yeah, so it's pretty simple that it's tied to where your Social Security recognizes you.
Got it.
It's all tied in. So if you have changed and updated your address with the Social Security Administration and the IRS, it's gonna like follow that.
Okay, that makes sense.
Mm-hmm.
I have another question. Someone had written in that they have commercial insurance from the federal government through their spouse's job. That person will be 65 this month. Do they still need to sign up for Medicare Part A?
So if it's completely covered, well, it's a federal employee. federal employee?
Yes.
So I'm not really sure of the answer to that. I'm gonna give you an answer that would apply to any kind of employee. You should always, when you're turning 65 and still working, always check with the benefits department to figure out whether or not they're going to require you to get your Part A, and will Part A be secondary to that employer coverage. That is basically a good rule of thumb to follow. And the thing about it is I generally recommend that since Part A is free, you might as well get it when you age in, because there's no cost to you. Get your Medicare card, get your Medicare number, because when you go off an employer plan and now you're applying for your Part B, you already have been assigned a Medicare number. So it's going to be a lot quicker for you to add B if you already have the A. And you don't then it's paperwork, submitting, updating your Medicare information to start to get Part B. So I feel like it's a good idea and there's no downside to doing it. But again, with the some employers require people to go ahead and get their Part A. So that would be something to check with the job.
Awesome, thank you. Another question. Someone wrote that they have Medicare A, B, and G, plus a separate dental plan from Delta Dental. And they've seen many advertisements regarding special dental coverage available to seniors in New Jersey through something called maybe Dental Alliance, which sounds too good to be true. So do you know of any such plan? Is there a catch to them? Should we just be changing the channel when those commercials come up?
Yeah, I'm not familiar with Dental Alliance, honestly. I've heard of Delta Dental, which is very popular, but I don't know what Dental Alliance is. So there's lots of advertising. I don't know what would be what they're enticing people with. I'm just very suspicious about any kind of advertising that happens this time of year to trick people into changing something that might be working just fine.
I hear you. What about if you had to pick the biggest disadvantage of joining a Medicare Advantage plan opposed to Medigap or a supplemental, what would your one huge negative be for that?
Okay. So I would say it's the worst case scenario. You know how lawyers, when you talk to lawyers, they give you the worst case scenario, and so you write your wills and your documents for all these potential things that may not or may happen to you. So I think that the one thing to consider is down the line, if you do have an extended nursing home stay or skilled nursing stay in an Advantage plan, it's covered just like original Medicare with that $200 a day after day 20 in skilled nursing that you're responsible for. Now, on the other side, though, Medicare Advantage plans cap. There's a maximum out-of-pocket limit. And thanks to competition, some of the companies are competing and lowering those. Some are raising that maximum out of pocket, but we are seeing some competition to entice people to take a chance on a Medicare Advantage because, well, the maximum in a year could be like $4,900 out of pocket. So once you've reached that limit, you're not going to pay any more anyway. So, but I do kind of have a profile type of people, Medicare supplement people versus Medicare Advantage. This might be helpful to think about. So Medicare supplement people are people who may travel a lot. Maybe they're snowbirds. Maybe they have grandkids. I have a friend who has grandkids in 3 different states. So if she travels to one of those states and gets sick, she doesn't want to have to worry about a hospital being in network, or if she needs some kind of care, she doesn't want to have to worry about network. So that supplement plan works well for her. Also, you have people who just don't want the hassle of bills. They don't want to pay as you go. They don't want to see bills. They want to know that everything's covered. And it's sort of a, convenience of knowing that you're going to pay up front for a lot to be covered. And then for the Medicare Advantage people, there are people who don't want to pay a high premium because they consider themselves healthy and they don't want to pay all that premium if they don't use it. They typically take no drugs. They take vitamins, and the Advantage plans have those over-the-counter benefits so they can buy all their vitamins and anything else that they want, and get the fitness membership. So, it's really personal preference. Also, there are some people who just can't afford the Medicare supplement premiums, and unfortunately, if they do have big medical events, they're still going to have to pay, but they pay as they need it. So, there's a lot of people listen to their friends who say, "Oh, you don't want a Medicare Advantage plan because of XYZ." But I think the the companies that run those plans are trying to keep people healthy. They're adding benefits to, enhance your home, add grab bars, like to add money to help keep you healthy. And the supplement plans is the original Medicare. There's really no care management that happens. So is one better than the other? It's just really kind of personal preference.
Understood.
I don't know
So let me ask you
helps.
this. Medicare Advantage plan, can you join? Can you sign on if you have a pre-existing condition?
Yes, you can.
Okay.
It's automatic acceptance. They cannot deny you. It is you can change every year during the annual enrollment period, and also during the first quarter of the year, you can change then as well. I have a little chart here that shows when you can switch. So you would switch if you move. And, another note about the people who do travel, though, there are national carriers that have big, extensive networks all over the country. So that, Aetna, United Healthcare, Cigna, they have hospitals and doctors all over the country. So there are people, I don't want to make it seem like you can't get an Advantage plan if you travel, but you'd want to stick to a national carrier, really. And if you move, again, think about where your permanent residency is. You would need to change your plan. And you will also need to change your Part D plan if you move out of state. Anything else?
That's all I have right now. Is there anything else any other slides we need to see?
Well, just going to talk a little bit about coming off of employer coverage, and what you should be doing when. So timing is important. And that's why I mentioned that it's kind of helpful to already have your A in place, even if you're past 65, no downside. And when it comes time to enroll in Medicare, whether you're turning 65 or you're coming off of employer plan, it's very simple now. I mean, even in the past year, this process has become a lot simpler. You don't even have to have, although it's helpful to have SSA.gov account, you don't have to sign up for Medicare. You can go to the home page, this is SSA.gov, where in the middle it says apply, sign up for Medicare, and then it'll take you to a page that kind of figures out, are you first eligible for Medicare and signing up? You could apply online, and then you would specify whether you are receiving Social Security benefits or not. And if not, you take one road. If you are, then that can all happen, where that Social Security, that Medicare premium comes right out of your Social Security benefit check. And most people, when they eventually sign up for their benefit, Social Security benefit, they like to have that premium just come right out of their benefit. Otherwise, you're going to pay quarterly payments for your Medicare plan. If you're coming off of an employer plan, there's a button for you. Sign up for Part B only. And I've just recently done this for people that I know. Very simple online forms. It even has the employer form that you will need your employer to sign. You can download it, give it to the employer, then scan it and bring it back into the application. Very simple process. But I always encourage people to follow up with their local Social Security office to make sure it was received, to find, to kind of like track it, to make sure that you're on track so that your benefit is timed to match when you leave your employer coverage, so you don't have a gap. And then the other thing about timing is that there are penalties if you're late to signing up for Medicare when you're first eligible. And it's 10% for every 12 months for Part B, you didn't sign up. And for Part D, it's 1% of the average Part D premium per month you didn't sign up. It kind of adds up. So that's about everything that I have for this. Again, like, in terms of, my experience in Medicare, I've been doing it for a number of years. I really kind of align with the major carriers. I think it's important. The quality of the company is important. And what I do is I help people kind of determine which is the best plan for them, based again on their doctors being in network, looking at their prescription drugs and some of their preferences. And whether or not you have a broker or not, you should, consider all of the things that you could be impacted by, making sure that you have your timing in place and, looking at what your overall costs are going to be.
So you had mentioned that you can still enroll in a supplemental program even if you passed the open enrollment period and you don't need a medical exam. So the question is, how difficult is that?
Oh, I see. So like if you maybe start out with an Advantage plan, a couple of years down the line, you want to supplement? Is that kind of the idea? Okay, let's see.
If you're, I'm not sure if you have the question, but it says enroll in its supplemental. Can you still enroll if you kind of pass the open enrollment period?
Oh, okay. Yeah. So you have to answer medical questions, and I don't know how difficult it is. I do know there are certain knockout things. You're not going to be knocked out for high blood pressure. Diabetes is a decline. Certain cardiac conditions, if you're on blood thinners, that's a decline. Or if you've had stroke, heart attack, cancer, those would be declines. And then in terms of other chronic conditions, it kind of depends. But so, which kind of is actually brings up a good point. So if you already have a lot of chronic conditions that require many specialists, many either like in-office injections, or you've recovered from cancer, but you're worried about a future recurrence, then I would encourage people to get the supplement from the beginning and just budget for that, just for peace of mind.
Awesome. So before we end, I want to give another 30 seconds. I was going to say 2 seconds. That's too short. Any other questions, concerns? What we're going to make this available to review if you want, but any other questions or concerns?
Thank you all for, I know that Medicare can be, make your eyes glaze over, but I hope that was helpful. And, I'm sure Jill and her team will share information. If you have any questions, you do have until December 7th to, look at changes. I have a Calendly for booking appointments, but if you have a broker, make your broker do the work. Ask them, because I know I'm getting a lot of questions now from clients as to whether things affect them. And that's one of the services I provide to look, especially if they have any major changes. So.
Well, thank you everyone for joining us today. Pamela, thank you as well for sharing your knowledge and expertise with our guests. We will be sending a follow-up email with Pamela's contact information in case anyone has questions or something comes up or you'd like to talk to her one-on-one. And as always, our goal at Forefront is to provide relevant and insightful content. I think we accomplished that today. So thanks again for joining, and we will speak with everybody soon.
Thank you, Jill.
Of course. Bye, everyone.